Hello and welcome, dear students. Today I'll be taking up a very short, small case on nausea and vomiting in pregnancy. It's a small topic, but it's definitely an important topic. This could be just a side complaint of your patient, and your Viva might just go in this direction, which is why I've tried to include it in one of my case discussions. On my app, there are already now around 35 or more case discussions posted by me on different case scenarios, both obstetrics and gynecology, and I'm adding to the list as we speak. So tonight is a case discussion on I won't exactly call it hyperemesis in pregnancy. It's going to be just nausea and vomiting in pregnancy. I'm going to be presenting two cases. One is a case in which there is just normal nausea, couple of vomitings, patient is still okay, and the other one will be a frank case of hyperemesis gravidarum, and how will we proceed with both the cases. So I present my case. My patient, Mrs. X, 24 years old, wife of Mr. Y, who's a semi-skilled worker, a resident of so-and-so place, is a primary gravida with LMP so-and-so with previous regular cycles, making her current period of gestation at around 8 weeks, 2 days, came to the OPD today with complaint of around 4 to 5 episodes of vomiting in a day since the past 1 week. History of presenting illness. As per the patient, this is a spontaneous conception, first detected by a home urine pregnancy test, followed by an ultrasound done 1 week back, confirming the pregnancy and cardiac activity of the fetus. Patient used to feel nauseous even from the time of confirmation of pregnancy, with a distaste for food. But since the past 1 week to around 10 days, she's been vomiting around 4 to 5 times a day. It's more in the morning and at sleep bedtime as compared to the entire day, associated more with the smell of food. She can still tolerate oral food, but liquids become difficult to tolerate. Mostly the vomiting happens thereafter. She's been taking some medication for it, but there is not much relief. This vomiting and nausea is not associated with any pain abdomen, loose stools, or fever, though she does complain of bloating and acidity on and off. There is no complaint of any headache, tinnitus, vertigo, or any visual disturbances associated. Patient has not got any blood investigations done as of now, and she is taking regularly some prenatal vitamins, most probably folic acid.